It's probably one of the most talked about, most ambitious, and yeah, most controversial plans in South Africa's recent history, the National Health Insurance, or NHI. So today, we're going to try and cut through all the noise to really understand what it is, what it promises, and what has so many people so worried. All right, let's get into it.
First things first, before we can even talk about the NHI as a solution, we have to get a handle on the problem it's trying to solve. And really, at its core, South Africa's healthcare system is a story of a deep, deep division.
You basically got what's called a two-tier system. It's like a tale of two different countries. On one side, you have this world-class private sector, giving amazing care to a relatively small part of the population. And on the other side, a public sector that's just massively overstretched and under-resourced, serving the vast majority of people. It's this inequality that the NHI is designed to tackle head-on.
Okay, so how does the government plan to fix such a massive imbalance? Well, the answer is the National Health Insurance. And it's not just a small tweak, it's a complete reimagining of how healthcare gets paid for and delivered in the country. So what is it really? In the simplest terms, the NHI wants to create one single healthcare system for everybody. It doesn't matter how much money you make, the goal is for every single South African to get the same standard of quality care, and it's all going to be paid for mainly through taxes. Here's a really good way to think about it. Instead of having hundreds of different private medical aids, you'd have one enormous state-run fund. Imagine just one giant financial pool that covers the entire nation. That's the idea.
And for you, as a patient, what would it actually feel like? Well, the journey would probably look something like this. You'd start by going to your local accredited clinic or GP. If you need something more specialized, they would refer you up the chain to a specialist or a hospital. And the crucial part? You wouldn't pay the doctor or hospital. The bill goes straight to that central NHI fund.
So you can see why the moral argument here is so powerful. Let's really dig into the key goals and promises that supporters say make the NHI not just a good idea, but an absolutely essential one.
First and foremost, it's about closing that massive inequality gap we talked about. By getting everyone to contribute, you spread the financial risk across the whole population, not just those who can afford it. The system is also designed to focus more on preventive care, to catch illnesses earlier. And as a single massive buyer, the government could in theory negotiate much lower prices for things like medicines and procedures.
Okay, but for every promise, critics have raised a serious and potentially devastating peril. So let's flip the coin and look at the other side of this plan, the side that has sparked enormous fear and opposition. And the red flags are, well, they're pretty major. The questions are huge. Like, where is all this money going to come from? Can the state actually manage something this complicated and this big? What happens to the private healthcare sector we have now? But there's one concern that seems to tower above all the others.
And that concern is corruption. We are talking about a single central fund that would control hundreds of billions of rand every single year. It would easily be one of the largest state-run funds on the entire continent.
And this gets right to the heart of the fear. For many people, when you look at the country's recent history with corruption and just mismanagement and state-owned companies, putting this much money and this much power in one place isn't just a risk, it's a giant flashing red light.
This isn't some abstract worry. It's a fear that's rooted in very recent, very painful public memory. The concern is that the NHI could end up following a script that just feels all too familiar to a lot of South Africans. Just think about it. Eskom and the power crisis. Transnet and the logistics nightmare. SAA and its endless bailouts. The fear is that the very same governance failures that have plagued these entities could now be applied to the nation's healthcare. So what do we do with this? You have this massive clash, a morally powerful idea on one side versus a practically terrifying risk on the other. Where does the truth actually lie? Let's try to sift through the debate.
The reality, as always, is pretty nuanced. Some concerns are absolutely valid. The risk of corruption, the state's actual ability to implement this, and whether it's financially sustainable, those are very real questions. Other fears are more debatable, like whether private healthcare would just collapse overnight. It's probably more likely to be a slow change. And the idea of an immediate, total system failure is probably a bit overblown.
And this brings us to the core dilemma, the really uncomfortable truth that, almost everyone agrees on. The current two-tier system, with all of its inequality, just isn't sustainable. Something has to change. But And this is the massive billion-rand but. The state has a very poor track record when it comes to managing huge, complex entities without corruption or massive inefficiency. And this is the fundamental conflict right at the heart of this entire NHI debate.
And so the whole conversation has kind of shifted. Very few people are arguing that we don't need healthcare reform. The real, sharp-edged debate now is whether this specific reform in its current shape, and given the state's current capacity, can actually be trusted to work.
And that leaves us right here with this final, critical question. Is the NHI a noble and necessary idea, but one that's maybe being set up for failure by a state that hasn't yet proven it can handle the responsibility? That is the question South Africa is grappling with right now.